Maintaining Intimacy in Long-Term Relationships. An evidence-based guide for mature couples. Introduction. The evolving landscape of mature intimacy, physical intimacy in long-term relationships, undergoes significant transformations as couples age together. These changes are normal, natural, and navigable with the right knowledge and approach. Research consistently shows that satisfying intimate relationships are possible and common throughout the lifespan, though they may look different than they did in earlier decades. According to data from the National Social Life, Health, and Aging Project, approximately 40% of people aged 65 to 80 report being sexually active, with many describing high levels of satisfaction. However, the same research reveals that communication about changing needs often lags behind physical changes, creating unnecessary gaps in understanding between partners. This guide explores evidence-based approaches to maintaining and enhancing intimacy as relationships and bodies mature, drawing on peer-reviewed research in gerontology, sexual medicine, psychology, and relationship science, understanding physical changes, the biology of aging, hormonal shifts, and their impact. Both men and women experience significant hormonal changes with age that directly affects sexual function and desire. Understanding these changes removes stigma and creates space for adaptation. For women, menopause typically occurs between ages 45 to 55, bringing decreased estrogen levels that affect multiple aspects of sexual function. The North American Menopause Society reports that these changes include vaginal tissue changes, thinning, decreased elasticity, reduced natural lubrication, changes in genital blood flow, shifts in desire patterns, altered arousal timelines. These changes don't mean the end of satisfying intimacy. They signal a need for adjustment. Research published in Menopause, the Journal of the North American Menopause Society, demonstrates that women who adapt their intimate practices to accommodate these changes maintain satisfaction levels comparable to earlier life stages. For men, while men don't experience a sudden hormonal shift like menopause, testosterone gradually declines about 1% per year after age 30. The American Urological Association notes this affects erectile function and rigidity, recovery time between intimate encounters, overall desire levels, energy and stamina, emotional connection to physical intimacy. Additionally, common medications for conditions like hypertension, diabetes, and depression can affect sexual function, making open communication with healthcare providers essential. Chronic health conditions. Many adults over 50 manage one or more chronic conditions that impact intimacy. The American Association of Retired Persons, AARP, surveys indicate that cardiovascular disease, diabetes, arthritis, and prostate issues are among the most common factors affecting sexual function in mature adults. However, research consistently shows that most chronic conditions are compatible with continued sexual activity, often with minor modifications. A study in the Journal of Sexual Medicine found that couples who discuss health limitations openly and creatively, adapt their intimate practices, report higher satisfaction than those who avoid the topic. The psychology of long-term intimacy. Breaking through comfort zone. Complacency. Long-term relationships offer deep emotional security, a tremendous asset for intimacy. However, they can also lead to routines that become predictable and eventually unstimulating. Relationship researcher Dr. Esther Perel's work on erotic intelligence suggests that maintaining both security and novelty is key to lasting intimate satisfaction. Research in the Journal of Sex Research demonstrates that couples who intentionally introduce novelty whether through new settings, different times of day, or varied approaches, report significantly higher satisfaction scores than those who maintain unchanged patterns for decades. This doesn't require dramatic changes. Small shifts in routine can reactivate neural pathways associated with novelty and reward, according to neuroscience research on dopamine systems. Communication, the foundation of intimate connection. Multiple studies identify communication as the strongest predictor of sexual satisfaction in long-term relationships. Yet research from the Kinsey Institute reveals that many couples rarely discuss specific preferences, changes in desire, or physical challenges. Common communication barriers include assumptions about what partners want or feel, fear of hurting feelings, embarrassment about discussing intimate topics, belief that good partners should just know, cultural or generational taboos around sex talk. Overcoming these barriers requires intentional effort but yields significant rewards. Research published in the Archives of Sexual Behavior found that couples who engaged in structured conversations about intimacy showed measurable improvements in satisfaction. Within just a few weeks, evidence-based techniques for enhanced connection. 1. Mindful presence and attention mindfulness. The practice of present moment awareness without judgment has emerged as a powerful tool for enhancing intimacy. Research from Dr. Laurie Brotto at the University of British Columbia demonstrates that mindfulness-based sex therapy significantly improves desire, arousal, and satisfaction, particularly for women experiencing age-related changes. Practical application. The core principle involves directing full attention to physical sensations, emotional feelings, and connection with your partner, rather than getting lost in distracting thoughts or concerns. Before intimate moments, take several deep breaths together. Make deliberate eye contact. Express appreciation or affection verbally. Intentionally set aside worries or to-do lists. During intimacy, notice physical sensations without judging them as good or bad. Observe your partner's responses with curiosity. Return attention to the present moment when minds wander. Focus on pleasure that exists rather than performance. Expectations research indicates that even brief mindfulness practices, 5 to 10 minutes, before intimate encounters can enhance presence and responsiveness. Extended sensory engagement is. Arousal patterns change with age. Extended sensory engagement becomes increasingly important. The International Society for Sexual Medicine notes that mature individuals often require more time and varied stimulation for full arousal compared to younger adults. The science, neural pathways involved in sexual response may require more input to achieve the same level of activation as aging affects nerve sensitivity and blood flow. However, this creates an opportunity for more comprehensive, whole-body experiences rather than rushing toward a single goal. Practical application. Expand intimate time to include varied sensory experiences. Touch. Explore different pressures, temperatures, and textures beyond specifically genital areas. Sound. Share verbal appreciation, breathing patterns, and other auditory cues. Sight. Maintain eye contact. Observe responses. Appreciate your partner's body. Scent. Notice natural scents and pheromones that signal arousal. Taste. Incorporate kissing and tasting as extended aspects of connection research in the Journal of Sex and Marital Therapy shows that couples who extend foreplay to 15-20 minutes or more report significantly higher satisfaction than those who rush through preliminary contact. The principle of responsive arousal sex. Researchers have identified two primary arousal patterns: spontaneous and responsive. while younger individuals more commonly experience spontaneous desire, wanting sex out of the blue. Research by Dr. Rosemary Basson shows that responsive desire, arousal that develops in response to stimulation and context, becomes more common with age, particularly for women. Understanding this shift is crucial. Responsive arousal is not less valid or satisfying. It simply requires different initiation and pacing. Practical application. For responsive arousal to flourish, create conducive environments, privacy, comfort, appropriate timing. Begin physical contact without pressure or expectations. Allow arousal to build, gradually through touch and connection. Recognize that desire may develop during, rather than before intimacy. Communicate that this pattern is normal, and acceptable studies show that couples who understand and embrace responsive arousal patterns report satisfaction levels equal to or higher than those relying on spontaneous desire. Strategic, variation and pattern. Interruption neuroplasticity research reveals that the brain responds more strongly to varied stimulation than repetitive patterns, as sensory receptors adapt to consistent stimulation, a process called habituation. Varied approaches maintain neural engagement and responsiveness. The science. The Kinsey Institute's research demonstrates that introducing variation in intimate encounters through position changes, rhythm adjustments, or environmental modifications sustains higher arousal levels compared to unchanging patterns. Practical application. Incorporate variation through timing. Explore different times of day when energy and privacy align. Location. Change settings within your home environment. Rhythm. Alternate between faster and slower pacing. Depth and angle. Adjust positioning for different sensations. Sequence. Vary which activities occur when initiative. Alternate. Who initiates and guides encounters the most. Key is intentional variation rather than random change. Pay attention to what resonates and build on successful experiments. Pelvic floor awareness and strength. Both men and women benefit significantly from pelvic floor awareness and strength. Yet this factor often goes unaddressed. Research published in the International Urogynecology Journal demonstrates that pelvic floor function directly impacts sexual satisfaction, arousal, and orgasmic capacity. For women, strong flexible pelvic floor muscles enhance sensation during penetration, orgasmic intensity, vaginal health and circulation, control over vaginal muscle engagement, overall genital awareness. For men, pelvic floor strength effects, erectile rigidity, ejaculatory control, orgasm intensity, prostate health, recovery between intimate encounters. Practical application. Basic pelvic floor exercises, often called Kegel exercises, involve identifying the correct muscles, those you'd use to stop urination midstream, contracting these muscles for 3-5 seconds, relaxing completely for 3-5 seconds, repeating 10-15 times, 2-3 times daily. Advanced practice involves quick contractions, pulse patterns, extended holds, up to 10 seconds, graduated intensity, light, medium, strong, integration during intimate activity. Physical therapists specializing in pelvic floor function can provide personalized guidance, particularly for individuals with specific concerns. 6. Synchronized breathing. Research on physiological synchrony between partners reveals that coordinated breathing enhances emotional connection, reduces performance anxiety, and supports arousal regulation. The science, studies using heart rate variability and respiratory monitoring show that partners who consciously sync their breathing experience reduced cortisol, stress hormone levels, enhanced oxytocin, bonding hormone release, greater sense of connection and intimacy, better arousal control and timing. Practical application. Practice synchronized breathing. Begin by lying beside each other, focusing on your partner's breathing pattern. Gradually match your breath rhythm to theirs, or find a mutual pace. Place hands on each other's chests or abdomen to enhance awareness. Incorporate this during intimate moments, particularly during pauses or slower phases. Use coordinated breathing to signal connection and presence. Even brief periods, 2 to 3 minutes, of synchronized breathing can deepen connection and calm nervous systems. 7. The power of anticipation. Neuroscience research on reward systems demonstrates that anticipation often generates stronger neural responses than the reward itself. This wanting system, driven by dopamine, can be leveraged to enhance desire and excitement in long-term relationships. The science. Dr. Helen Fisher's fMRI studies of couples in long-term relationships reveal that those who maintain high satisfaction show activation in brain regions associated with anticipation and reward, similar to newly romantic couples. Practical application. Build anticipation through planned intimacy. Rather than viewing scheduled intimacy as unromantic, frame it as special time to anticipate, like reservations at a favorite restaurant. Suggestive communication. Text or verbally express interest or desire hours before privacy is possible. Gradual build-up. Begin physical affection and flirtation well before actual intimate time. Delayed gratification. Occasionally extend anticipation deliberately, building desire over hours or even days. Verbal preview. Discuss what you're looking forward to experiencing together. Research shows that couples who cultivate anticipation report higher desire levels and greater satisfaction with intimate encounters. Addressing common challenges. Managing physical discomfort. Physical discomfort during intimacy is neither inevitable nor something to simply endure. Multiple evidence-based solutions exist. Lubrication. Adequate lubrication is essential, particularly after menopause. The American College of Obstetricians and Gynecologists recommends water-based or silicone-based lubricants for general use. Longer-lasting formulations for extended intimacy. pH-balanced products. Designed for mature vaginal tissue. Generous application and reapplication as needed. Positioning. Joint pain, arthritis, or mobility limitations may make traditional positions uncomfortable. Occupational therapy research on positioning suggests side-lying positions that reduce weight-bearing stress. Use of pillows for support and angle adjustment. Sitting or semi-reclined positions that accommodate back issues. Open communication about what feels comfortable versus painful. Timing. For individuals managing conditions like arthritis, timing intimacy to coincide with peak medication effectiveness can significantly reduce discomfort. Medical consultation. Persistent pain warrants consultation with healthcare providers specializing in sexual medicine, as various treatments, hormonal and non-hormonal, can address underlying causes. Navigating desire, differences in desire levels are among the most common challenges in long-term relationships, particularly as aging affects partners differently. Research from the Journal of Sex and Marital Therapy indicates that desire discrepancies affect 80% of couples at some point. Understanding the context. Desire discrepancies often reflect different arousal patterns, spontaneous versus responsive, stress and life circumstances, health conditions or medications, emotional connection quality, unaddressed relationship issues, evidence-based approaches. Reframe the issue. Rather than viewing one partner as having a problem, recognize desire differences as relationship dynamics to navigate together. Expand definitions. Research shows that satisfaction isn't solely about frequency, but about quality, variety, and emotional connection. Compromise creatively. The higher desire partner may need to sometimes accept non-penetrative intimacy. The lower desire partner might engage in intimate contact even when arousal isn't spontaneous. Address underlying factors. Work together to identify and address controllable factors affecting desire, stress, scheduling, privacy, relationship conflicts. Consider professional support. Sex therapists specializing in mature couples can provide targeted strategies for navigating desire differences. Overcoming performance. Performance anxiety affects both men and women, often creating self-fulfilling cycles of worry and dysfunction. Research published in Sexual Medicine Reviews identifies several evidence-based approaches. Cognitive restructuring. Challenge unhelpful thoughts. I must perform perfectly. We're here to connect and share pleasure. If I can't achieve specific outcome, I've failed. There are many ways to experience and share intimacy. My partner will be disappointed. We can communicate about what feels good. Sensate focus. Developed by Masters and Johnson, this therapeutic technique involves temporarily removing goal-oriented sexual activity, practicing touch and sensory awareness without performance expectations, gradually reintroducing intimate activities as comfort increases, focusing on present sensation rather than outcome achievement. Research demonstrates high success rates for sensate focus in reducing performance anxiety and restoring intimate function. Medical options. For men experiencing erectile dysfunction, various evidence-based treatments exist. Oral medications, PDE5 inhibitors, vacuum erection devices, penile injections, implants for severe cases. For women experiencing arousal or orgasm difficulties, topical arousal enhancers, vaginal estrogen therapy, pelvic floor physical therapy, vibrator-assisted stimulation consultation with healthcare providers specializing in sexual medicine can identify appropriate options. The role of emotional intimacy. While this guide focuses primarily on physical aspects of intimacy, research consistently demonstrates that emotional connection is the foundation upon which satisfying physical intimacy is built. The Gottman Method. Insights relationship researchers, Drs. John and Julie Gottman, have studied thousands of couples over decades. Their findings reveal that couples maintaining strong, intimate lives share key characteristics: friendship and fondness. Successful couples maintain genuine liking and respect for each other, expressed through regular expressions of appreciation, interest in each other's daily experiences, shared humor and inside jokes, remembering important details about each other's lives. Turning toward versus turning away. Throughout each day, partners make bids for connection, small requests for attention, support, or engagement. Research shows that couples who consistently turn toward these bids, responding positively, maintain stronger intimate bonds than those who ignore or reject such bids. Managing conflict constructively. All couples experience conflict, but relationship satisfaction depends on how conflicts are handled. Successful couples approach disagreements as problems to solve together, avoid criticism, contempt, defensiveness, and stonewalling. Use repair attempts to de-escalate tensions, maintain respect, even during disagreement. The vulnerability intimacy connection. Research by Dr. Brené Brown on vulnerability reveals that intimate connection requires willingness to be seen fully, including fears, insecurities, and imperfections. In the context of physical intimacy, this means sharing authentic feelings, expressing real desires and preferences, even if vulnerable, admitting when something isn't working without shame, asking for what you need rather than expecting partners to guess, acknowledging changes in your body or responses, receiving partners' vulnerability, responding with empathy rather than judgment, appreciating courage, required to express needs, taking concerns seriously rather than dismissing them, working collaboratively towards solutions. Couples who cultivate emotional safety create environments where physical intimacy can flourish despite age-related changes. Practical implementation, creating your intimacy. Plan research shows that couples benefit from structured, intentional approaches to maintaining intimacy. Here's an evidence-based framework. Step 1. Individual reflection. Each partner should separately consider current satisfaction. On a scale of 1 to 10, how satisfied am I with our intimate life? 2. Desired changes. What would increase my satisfaction? 3. Personal challenges. What physical, emotional, or practical factors affect my intimate experience? 4. Strengths to build on. What aspects of our intimate life are working well? 5. Fears and concerns. What worries do I have about discussing intimacy with my partner? Step 2. Structured conversation schedule. Dedicated time, not during or immediately after intimacy, to share reflections. Guidelines for productive discussion. Use I statements. I feel. I would like. Rather than you accusations. Listen to understand, rather than to defend or rebut. Ask clarifying questions with genuine curiosity. Acknowledge your partner's perspective, even if different from yours. Focus on collaboration. How can we work on this together? Step 3. Collaborative goal setting together. Identify 2 to 3 specific, achievable goals. Effective goals are specific. We'll incorporate 15 minutes of sensory touch before intimacy, rather than we'll improve foreplay. Measurable. We'll have intimate time twice weekly, rather than we'll be intimate more often. Achievable. Based on current health, schedules, and energy levels. Relevant. Addressing issues you've both identified. Time-bound. We'll try this approach for 1 month, then reassess. Step 4. Experimentation and feedback approach. New techniques as experiments. Try each new approach 3 to 4 times before evaluating. First attempts are rarely perfect. Debrief after intimate encounters. What worked? What didn't? What should we try next time? Maintain curiosity and humor about the learning process. Celebrate successes. even small ones. Adjust approaches based on feedback. Satya. Step 5. Regular check-ins. Research shows that couples who regularly discuss their intimate life maintain higher satisfaction. Monthly check-ins. Onsai. Schedule 20 to 30 minutes for intimate life discussion. Review what's working well. Identify any emerging challenges. Adjust goals or approaches as needed. Maintain open communication channels. Check-in. When to seek professional help. While many couples successfully navigate intimate changes independently, professional support can be invaluable when communication about intimacy consistently leads to conflict, physical symptoms, pain, dysfunction, persist despite self-help attempts, emotional issues, depression, anxiety, past trauma, impact intimacy, desire discrepancies, create significant relationship distress, performance issues, don't improve with basic interventions, medical conditions or medications significantly affect intimate function. Types of professional support. Sex therapists. Licensed mental health professionals with specialized training in sexual issues. The American Association of Sexuality Educators. Counselors and therapists. AASECT maintains a directory of certified professionals. Pelvic floor, physical therapists. Specialists who address muscular and functional issues affecting intimate function through targeted exercises and manual therapy. Urologists and gynecologists. Medical doctors specializing in sexual medicine can address hormonal, vascular, and anatomical factors affecting intimate function. Couples therapists. When intimate challenges reflect broader relationship issues, couples therapy addresses underlying dynamics affecting all aspects of connection. Conclusion. Reframing intimate aging. Cultural narratives often portray aging as the end of satisfying intimate life. Research decisively contradicts this narrative. While age brings changes, it also offers opportunities. Depth over intensity. Mature intimate relationships often emphasize emotional connection, mutual pleasure, and quality over the performance-focused approach, more common in younger years. Freedom from reproductive concerns. Post-reproductive life can bring liberation from contraception worries and menstruation management, creating new spontaneity. Self-knowledge. Decades of life experience often bring better self-understanding, including knowledge of personal preferences, boundaries, and desires, assets for intimate satisfaction. Prioritization. As life perspectives shift with age, many individuals report increased prioritization of relationship quality and intimate connection over career or material achievements. Communication skills. Long-term relationships offer opportunities to develop deep communication skills that enhance all aspects of connection, including physical intimacy. The key is intentionality. Couples who actively adapt to changes, communicate openly, experiment creatively, and maintain emotional connection can enjoy satisfying intimate lives throughout their lifespans. This isn't automatic. It requires effort, vulnerability, and willingness to learn and grow together. But research consistently shows that this effort yields profound rewards, deeper connection, sustained satisfaction, and intimate relationships that continue enriching lives for decades. Intimacy at any age is a practice, not a performance. It's about presence, not perfection. It's about connection, not achievement. And it's absolutely possible, regardless of how many birthdays you've celebrated together. Resources for continued learning. American Association of Sexuality Educators, Counselors and Therapists, AASECT, the Gottman Institute, North American Menopause Society, American Urological Association, International Society for Sexual Medicine, ARP resources on sexuality and aging. Note: this guide provides educational information based on research in relationship science, sexual medicine, and gerontology. It is not a substitute for personalized medical advice, diagnosis, or treatment. Consult healthcare providers for individual concerns. Impacts sexual satisfaction.